Anemia is a blood disorder that basically means a deficiency of hemoglobin in the blood. This deficiency can be caused by either having too few RBCs or too little hemoglobin in the cells. The normal range of hemoglobin for males is 13 to 17 gram per deciliter, and for females, it is 12 to 15 gram per deciliter. When the levels of hemoglobin vary from these standards, a person is said to be anemic. In our body, red blood cells carry hemoglobin, which in turn combines with oxygen. So, it's the hemoglobin that helps in the transport of oxygen. Red blood cells have a lifespan of 120 days in the bloodstream. So, when their time comes to an end, they are removed by the reticuloendothelial system. This system includes the spleen and the liver, where the macrophages and monocytes clear the old and abnormal RBCs. It is important to know this because conditions related to the spleen and liver may be contributing to causing anemia. There are various causes of anemia like excessive blood loss, decreased red cell production, or increased red cell destruction. All these incidents are caused either by inherited disorders or environmental influences, such as nutritional problems, infections, and exposure to drugs or toxins. For a better understanding, let's classify anemia based on two important factors. The first one is morphological classification, which is based on appearance, and the second is etiological, which is based on the cause or origin. The appearance of an RBC is very simple. We will mainly look at the color and size of the cell for the purpose of classification. The size of the RBC is determined by mean corpuscular volume, and color is determined by mean corpuscular hemoglobin concentration, also called MCHC. Remember that the RBC gets its color because of hemoglobin. By this method, anemia is classified into four types. The first one is normocytic normochromic anemia. Here, normo means normal, so the size and colors of RBC is normal, but the number of RBCs is less. The second is macrocytic normochromic anemia. Macro means big. The RBCs are larger in size, but the color is normal. Next is macrocytic hypochromic anemia. Here, the size is big and the color is pale. The last one here is microcytic hypochromic anemia. In this one, the cells are microcytic, meaning small-sized and pale-colored. Now that we know the different appearances of RBCs, let's find out the classification of anemia based on its causes. Various causes will result in different types of RBC structures. By the end of this video, you will be able to identify the possible types of anemia through histological images. On the basis of etiology, that is, cause or origin, anemia is divided into 5 types. The first one is hemorrhagic anemia, also known as blood loss anemia. This type can occur due to acute or chronic hemorrhagic conditions. Acute refers to a sudden and excessive loss of blood due to an injury such as in a case of an accident. After rapid blood loss, the body replaces the fluid portion of the plasma in 1 to 3 days, but this response results in a low concentration of RBCs. If the hemorrhage is controlled, RBC concentration usually returns to normal within 3 to 6 weeks. When the blood loss is chronic due to conditions like peptic ulcers, purpura, hemophilia, etc., the patient frequently cannot absorb enough iron from the intestines to form hemoglobin as rapidly as it is lost. So, the RBCs that are produced are smaller than normal and have too little hemoglobin inside them. This results in microcytic hypochromic anemia. The second type is hemolytic anemia. Hemolysis means destruction of RBCs. When there is excessive destruction of RBCs, it should be compensated by increased RBC production. When the RBC production does not increase and destruction of RBCs continues, it results in hemolytic anemia. The factors that cause hemolysis could be external or internal, depending on whether they are present inside or outside the blood cells. Depending on these factors, hemolytic anemia is classified as extrinsic and intrinsic hemolytic anemia. Extrinsic hemolytic anemia is the type of anemia caused by destruction of RBCs by external factors. This means that healthy RBCs are hemolyzed by factors outside the blood cells, such as liver failure, renal disorders, burns, infections like malaria, drugs like penicillin, anti-malarial drugs, and sulfa drugs. This type of anemia is also called autoimmune hemolytic anemia. In this scenario, the RBCs have a normocytic normochromic appearance. Intrinsic hemolytic anemia is the type of anemia caused by destruction of RBCs because of the defective RBCs. So, the problem is in the blood cell itself. The RBCs that are produced are unhealthy and short-lived. They are destroyed faster than they can be formed. This type of anemia often results from inherited conditions like hereditary spherocytosis, sickle cell anemia, and thalassemia. Because of the abnormal shape of RBCs in these conditions, they become more fragile. So, they rupture easily as they go through the capillaries, especially through the spleen. The number of RBCs formed may be normal or even much greater than normal. The next type is aplastic anemia. Aplasia means lack of functioning, and in this case, it refers to the lack of functioning of the bone marrow, which is the production house of RBCs. This means a person suffering from aplastic anemia has reduced production of RBCs. It could be because of high exposure to radiation, chemotherapy, high doses of toxic chemicals such as insecticides, or autoimmune diseases like lupus erythematosus. Next in line is nutrition deficiency anemia. When the RBC is produced in the body, it requires certain nutritive factors for maturation. In absence of necessary factors such as vitamin B12, folic acid, and vitamin C, the process of formation and functioning of RBCs is affected, which further causes anemia. Let us talk a bit more about the deficiency of B12. Anemia caused by a lack of vitamin B12 is called pernicious anemia or Addison's anemia. We need certain intrinsic factors to absorb the vitamins from our food. When there is atrophy of our gastric mucosa, there is reduced production of intrinsic factor and the absorption of vitamin B12 is affected. B12 is important to us because it is the maturation factor for RBC. If the cells do not mature, they cannot fulfill the responsibility well. Though the hemoglobin synthesis is not affected much, it is difficult for these patients to maintain a healthy level. Pernicious anemia is more common in females than males. RBCs are larger and immature with almost normal or slightly low hemoglobin level. So, the cells are macrocytic and normochromic or hypochromic. In a patient with this type of anemia, you can see a lemon yellow tinge to the skin and red sore tongue. In extreme conditions, the patient may have neurological disorders such as paresthesia, that is abnormal sensations like numbness, tingling, burning, etc. Progressive weakness, and ataxia, which means muscular incoordination. Megaloblastic anemia is due to the deficiency of another maturation factor called folic acid. Due to the deficiency of this factor, the RBCs are not matured. They grow too large with odd shapes and are called megaloblasts. These RBCs can rupture easily. Features of pernicious anemia appear in megaloblastic anemia also, but neurological disorders may not develop. Iron deficiency anemia is the most common type of anemia. It develops due to a lack of iron for hemoglobin synthesis. In this case, RBCs are microcytic and hypochromic. The main causes of iron deficiency anemia are loss of blood, decreased intake of iron, poor absorption of iron from the intestine, and increased demand for iron in conditions like growth and pregnancy. The important features of iron deficiency anemia are brittle nails, spoon-shaped nails, called as koilonychiasis, brittle hair, atrophy of the papilla of tongue, and dysphagia, that is, difficulty in swallowing. Now, let's understand how anemia affects the function of the circulatory system. Remember that the viscosity of the blood depends on the blood concentration of RBCs. So, when a person is severely anemic, the blood viscosity will obviously decrease. Less viscous means easy to flow. So, greater than normal quantities of blood flow through the tissues and return to the heart. This greatly increases the cardiac output. In anemia, there is reduced transport of oxygen by the blood. This results in hypoxia. Hypoxia causes the peripheral tissue blood vessels to dilate, which further increases the amount of blood returning to the heart, causing a greater increase in cardiac output. So, we can now see that one of the major effects of anemia is greatly increased cardiac output as well as increased pumping workload on the heart. During exercise, we know that the heart needs to pump a lot of blood. So, when a person with anemia begins to exercise, the heart is not capable of pumping much greater quantities of blood than it is already pumping. Also, there is increased demand for oxygen during exercise. But in anemia, due to extreme tissue hypoxia, acute cardiac failure may occur. Now, can you think about the signs and symptoms seen in a patient with anemia? Reduced hemoglobin in the blood means that there is going to be a reduction in the oxygen carrying capacity of blood. This leads to a state of hypoxia. So, We can see that tiredness or fatigue is a common feature in all anemic patients because they have an overall reduced oxygen supply in the blood. We can also see the effects on the skin. There is a pale appearance which is significantly noticed on the skin of palms and mucous membranes of the tongue and sclera. There is also dryness of the skin and loss of elasticity. We know that hemoglobin carries oxygen. So, when it is reduced in anemia, the respiratory and circulatory systems are affected. They try to compensate by working at a faster rate as we just learned. So, in severe anemia, we can observe increased respiratory rates, increased heart rate, and cardiac output. Other signs and symptoms important in anemia are anorexia or decreased appetite, dizziness, vomiting, increased basal metabolic rate or BMR, and irritability. In females, we can also see a disturbance in the menstrual cycles. Alright, that's it for this video. Let's do a quick recap. Anemia is a blood disorder that basically means a deficiency of hemoglobin in the blood. This deficiency can be caused by either having too few RBCs or too little hemoglobin in the cells. The normal range of hemoglobin for males is 13 to 17 grams per deciliter, and for females it is 12 to 15 grams per deciliter. There are various causes of anemia like excessive blood loss, decreased red cell production, or increased red cell destruction. All these incidents are caused either by inherited disorders or environmental influences such as nutritional problems, infections, and exposure to drugs or toxins. Anemia is classified into 4 types. The first one is normocytic normochromic anemia. The second is macrocytic normochromic anemia. Next is macrocytic hypochromic anemia. And lastly, it is microcytic hypochromic anemia. On the basis of etiology, that is cause or origin, anemia is divided into 5 types. The first one is hemorrhagic anemia, also known as blood loss anemia. The second type is hemolytic anemia. Next we have aplastic anemia. Then we have nutrition deficiency anemia.